Good morning, everyone. My name is Fernando, and today's topic of choice I will be discussing should physician assisted suicide be legalized in the US for terminally ill patients and why I agree it should be legalized. Imagine you make a visit to your primary care doctor and you are suffering from lung cancer. Your doctor informs you you have developed stage 4 lung cancer and that it is terminal. Your life expectancy can be anywhere between a couple months to 2 years max. You are devastated with these news. According to the National Cancer Institute, in 2022, in the US alone, 1.6 million new cases of cancers have developed, with an estimated of 600,000 of them dying from them. Breast, prostate, and lung cancer were the highest for the new ones, while lung, colon, and pancreatic cancer were the highest deaths this year for cancers. Though cancer isn't the only form of terminal illness, according to Yale University of Journal of Medicine, in a pie chart graph from Oregon during 1998 to 2017, the top four terminally ill patients who went through physician assisted suicide were cancer, ALS disease, chronic lower respiratory disease, and heart disease. Now, you may be asking yourself, it's nice to see statistics and all, but what is physician assisted suicide? Well, the answer to that question is physician assisted suicide is an act where a licensed physician provides the patient's assistance with their death by providing the patient either in capsule form, which will be called psychobarbital, or liquid form, which is called pentobarbital. 9 grams in a capsule is a lethal dose, and 10 grams in a liquid form is a lethal dose. So far in the US, only 9 states have it legal in the District of Columbia: California, Colorado, Hawaii, New Jersey, New Mexico, Oregon, Vermont, and Washington. 33 states have laws prohibiting it. 3 states, Alabama, Massachusetts, and Wyoming, prohibit it by common law. 4 states, Nevada, North Carolina, Utah, and Wyoming, have no state's laws regarding common law or are otherwise unclear on the legality of it. In the state of California, for example, in order for the patient to go through and be qualified for this procedure, they must be at least 18 years or older, resident of the state, capable of making healthcare decisions, diagnosed with a terminal illness that will lead to their death within 6 months, and physically and mentally capable of administering the dying drug itself. However, the physician that must be licensed within the state must also be able to be qualified to diagnose the patient's illness within 6 months or less to live, must be certified with a consulting physician who must also certify the patient's mental capacity to make those healthcare decisions. If patient is impaired, they must refer to them for a psych evaluation or offer alternative care, which includes palliative care or hospice care. The patients who choose to get physician assisted suicides choose to go through with it based on patient's autonomy and the ability to not go through future pain and suffering. Patient autonomy is the ability to choose their own destiny, which gives the patient more control of their own direction towards life. The US views of how morally acceptable they are for those seeking physician assisted suicide have flip flopped throughout the years. However, recently, since 2017, the majority have agreed with legalizing physician assisted suicide. In Oregon, for example, patients who have died from a lethal dose of medications were cancer patients, with the government treating their medications. In conclusion, I believe patients who are terminally ill should have the right to be able to access physician assisted suicide in all states in order to provide them with different alternatives if they choose to go with that path. It will provide the patient satisfaction with autonomy and relief of future suffering and pain. I hope today's topic I have informed new people information of the topic. Thank you.